friends, what's up? Hope you're doing well. All right, so a lot of people ask me a big question or the question about what happens between the time that we are now here interested in weight loss surgery to the time we are ready for weight loss surgery. What is the process? What do we need to do to be ready? Well, the answer is very simple. Weight loss surgery is a process. Weight loss surgery is a program, and things need to happen before you're elected ready for weight loss surgery. So what are the things that need to take place? Well, there are a few boxes we need to check. Generally speaking, for somebody who's overall healthy, except for weight loss, except for the excess weight, few things need to take place to make sure that we're doing things right. So what are those things? First of all, consultation with me, which could be virtual or in person. Second, we need to check the benefit. Insurance, very important. Check the benefit with the medical insurance company that they do cover for weight loss surgery. Then after that, we refer every patient for a psych eval. We also refer a patient for a dietitian evaluation and treatment. It's not really treatment, it's more of guidance. And for the dietary part, it may take a few sessions prior to surgery and definitely sessions as needed. There's one session that needs to take place the first 6 weeks after surgery, which is a refresher course. And then after that, few sessions here and there as needed, because everybody needs some guidance when it comes to what needs to happen after surgery. Now, when it comes to psychological evaluation, it is a requirement, and most of the time it's either 1 or 2 sessions that could take place either virtually or in person. These days, most of our dietary or dietitian sessions are virtual. But what else? We need to make sure the heart is good. The least we can do is do a tracing called an EKG. And sometimes when a patient has had issues with the heart, we send them or refer them to cardiology for cardiologic evaluation. And evidently, if a patient has significant medical problems and they may have been smoking, then it's warranted to have a cardiology evaluation. Then what else? We do chest x-rays. We look at the lungs, make sure that the lungs are clear and no surprises are there. Then what else do? We do an ultrasound of the liver. We like to look at the liver, and check how big is the liver and whether the patient has or does not have gallstones. What else? Then we proceed further and we do blood work. And we do pretty extensive blood work, and we look at a lot of parameters. We look at what we call the CBC, that's the regular blood work. We look at the kidney chemistry, the liver chemistry, thyroid function, hormones. We look at the sugar. We look at vitamins. We look at essential elements. So we look at every corner, making sure that all these things are all checked. Otherwise, we will have to replace them before surgery. What else? There are some people who may have signs of sleep apnea. So they may require what we call a sleep study. And the sleep study could take place as an outpatient. Pretty straightforward, and it helps people tremendously, especially if they are diagnosed with sleep apnea. What they will need to carry to have a CPAP or a BiPAP machine until they start losing weight. And the good news is when people are over surgery, when they're done with surgery, that they've lost a significant amount of weight, especially the first 6 months, the sleep apnea goes away and they won't require CPAP or BiPAP. And then what else? We need to make sure that people are up to date when it comes to cancer screening. What does that mean? Cancer screening means there are people, like, as an example, male and females after the age of 50 need to have a colonoscopy, a screen colonoscopy. Okay, that's one thing. Women need to have Pap smear at any point in their lives. They also need a yearly mammogram after the age of 40. Men need to have their prostate checked after the age of 50, and sometimes earlier. So these screening tools are extremely important. The word screening means that we're looking for early trouble. or we're just ruling out any signs of cancer, because it wouldn't be wise to proceed with weight loss surgery if the patient has not been cleared from any potential cancers, because that will become a priority. Should we find anything on the colonoscopy or on the prostate screening or mammogram, then that will take over the priority. That will be the priority over weight loss surgery. What are we left with? I left these here the way I left them because it's very important to know that we add more things to be done if the patient or the candidate for weight loss surgery has other elements that need to be checked. For example, if the person had weight loss surgery before, that we need to retrieve all the documentation from the prior surgical program. If we're contemplating doing weight loss surgery, what else? The person may have some problems with his or her lungs, may need to see what we call a lung specialist, maybe a blood specialist, maybe arthritis specialist, and so on and so forth. So this could really, get, I won't say overwhelming, but the list could extend. The last not least here is the EGD. What's the EGD? An EGD means that we screen the upper part of the GI tract through an upper endoscopy. Like we do colonoscopy, we do an upper endoscopy. My time is about 5 minutes. With anesthesia altogether, it's approximately 15, maybe 20 minutes. Twilight anesthesia, no need for special preoperative preparation, is in and out, and the candidate or the patient is able to go home after half hour, maybe 45 minutes from the end of the procedure. No pain, no even remembrance of what happened. And how do we do it? I'm going to move to this corner here just to show you. Suppose this is the mouth, and then this is the esophagus, the tube that connects the mouth to the stomach, and then this is the rest of the bowel. So when we do upper endoscopy, imagine there's a camera that goes down here, and then within this area, we start looking for any elements that would go either against surgery or need to be fixed prior to surgery. For example, irritation at this area, This is called duodenitis. This is called gastritis, or maybe a hiatal hernia, which is the protrusion of the stomach into the chest cavity. It's called hiatal hernia, which we see a lot. This might warrant a repair at the time of the weight loss surgery. Or maybe a bacteria that's called Helicobacter pylori that will need to be treated prior to surgery. Now, doing this may look overwhelming. Promise you, for committed people, it will definitely take, I'll write it down here, it will definitely take a few weeks to maybe a couple of months. Now, it depends on what the insurance requires, because the insurance may slow it down or may allow it to go faster. My recommendation to people is to be really proactive and then get things done as a group of things. For example, blood work to be done with the tracing of the heart, the x-rays, and so on and so forth. And I've had people really sticking to weeks. They get things done within weeks rather than months, several weeks, obviously. And the earlier you get things scheduled with, for example, the psychological evaluation, the dietitian, and maybe other specialists, the better. Hope this is helpful. Take care, and hope to see you soon.